I have 25 years old patient who is at her PCP's office with chief complaint of vaginal discharge. So her history of a present illness is she is a 25 years old Caucasian female present in a clinic with the chief complaint of a vaginal discharge. So her discharge is watery in color, like she has noticed this discharge from last week. And she had this discharge, vaginal discharge, like watery color discharge 2 months ago, but there was no auto on it, and it got resolved by itself in 3 days. But this time she was thinking it will resolve by itself, but it's been a week. There is no improvement, and now she has noticed auto on it, so which she thinks it is a fishy smell. It's getting like the odor is getting stronger, and she is more concerned about it this time since it did not get resolved by itself. And she denies any rash, any rash on her like vagina. She denies any irritation, but painful or any different sensation on her vagina. But sometimes she feels it is a little irritated while she walks. But she denies any a milky color. She denies itchiness, no rashes, and she refused having any intercourse recently. A patient stated that she does not have any sexual partner. She had a boyfriend 2 years ago, which she had a breakup, and she does not have any sexual partner since then. After that, and she denies using any soap on her vagina, any douches, any use of douches. She denies it. And on past medical history, she does not have any past medical history, and she denies taking any medication other than just multivitamin. She denies any recently any antibiotic or any other medication. She has a family history. On a family history, she has her mom diagnosed as a hypertension at the age of 49, and she started taking a medication for hypertension since then. Whereas her dad was diagnosed as prostate cancer at the age of 55. And she has on her social history, she is currently student doing her bachelor degree. She lives in her apartment. She denies taking any illicit drugs. She denies any she does not smoke. She does not drink alcohol, denies alcohol consumption other than she drinks wine once in a while when there is a family gathering or friends gathering once in a while. Very small, a very small amount of wine consumption, but no issues with alcohol abuse. And on her she does not have any known known medication allergies. And she, on her review of symptoms, on her she denies any head injury. She denies any eye infection or ear infection or any problem with her mouth. She denies any issues with her neck or throat. She on respiration, she denies any cough, any shortness of breath. She denies chest pain. on cardiovascular. She denies any chest pain, palpitation, or like any leg edema or anything. She on GI, she denies any abdominal distension or tenderness. She denies nausea, vomiting, constipation, or diarrhea. On genitourinary, she denies any problem with the urination. She denies urgency, frequency of urination, or pain, dysuria. She just have a problem with the like vaginal discharge that started from the last week, and more concerned because
it's 7 o'clock.
It's all like she has noticed the odor on it. And musculoskeletal, she denies any arthralgia, myalgia, rheumatic arthritis. She denies any back pain or any injuries. No surgery history related to her musculoskeletal. So on neurological, she denies any seizure, weakness, or any lightheadedness. Her psychiatric history, her behavior history, she denies any anxiety, any history of anxiety. She denies any depression. She denies any of her behavioral issues. On the physical, under physical examination, her vitals, her blood pressure was 116/65. Her pulse was 72, regular rate and rhythm, and her respiration was 16 breaths per minute, and it was normal. Her temperature 96.8. Her height was 5'7", and her weight was 156 pound, and her BMI was 24.4. And under her physical examination, there's like no sore throat. Her like no problem with her, like no thyroid issues, no enlargement of thyroid. Her color of the hair was blonde color, and the head size is normal. No vision changes. Her pupil was both equal size and constrict and to light, react to light. And her ears, no discharge. Tympanic membrane gray color. So no any problem with hearing. And her neck was like normal range of motion. Her cardio, rate and rhythm normal. Pulse normal, +2 with her pulse. Pulmonary normal. Respiratory pattern, no accessory muscles used while breathing in and out. Breath sound clear bilaterally through all the anterior and posterior, lateral, anterior, posterior, and lateral. So her abdomen was normal. Bowel sound present and all four quadrant. Her abdomen soft, and no distended or tenderness noticed. Her musculoskeletal, her range of motion on upper and lower extremities normal. No edema on upper or lower extremities. Her skin was warm and dry to touch. No bruises or no laceration or no any lesion. And her neurological mental status was, she was alert. She's alert, oriented to time, place, person, and situation. Her like no any problem with her behavior. She is very like on a behavioral and psychiatric. Her mood was appropriate to the situation, and normal insight, normal judgment, and based on her history and symptoms, the differential diagnosis I can think of is like the main I can think is the most probably is bacterial vaginosis. And on the other differential diagnosis I can think of as a yeast infection, or since she is not sexually like active recently, so I'm not concerned about STD. But it could be a BV, I mean, most probably, or yeast infection, or pelvic inflammatory disease, which is least likely. She does not have any pain. Also, her menstrual cycle is normal. She had a period 2 weeks ago, and she does not have any issues with her period. So we can also do a urine test, just to rule out UTIs. Since she does not have any other symptoms, it is least likely, but still we can add in our differential diagnosis, and we can do a urine dip as well, just to rule out UTI. So these are my thoughts for the patient. And yeah, we need to do a diagnostic test, we need to do a sword swab, like a vaginal swab, to diagnose, we have to send a BV lab as a BV, and then yeast infection. If she wants, we can do a STD, but since she does not have any concern about STD, she is not sexually active, it's not necessary. But if she wants, just for if she wanted to do it, it's up to her, but it's not necessary to do a STD test since she is not actively sexually active. So these are my thoughts. Thank you.